cornerstone of correct core activation is the diaphragmatic breathing. The diaphragm is a big dome-shaped muscle at the base of your lungs, dividing your thoracic cavity and abdominal cavity. Diaphragmatic breathing is a deep breathing technique that allows us to fully engage the diaphragm during each breath and increases the efficiency of your lungs. When you inhale, the diaphragm contracts, tightens, flattens, and moves downward, creating more space in the chest cavity, sucking air into your lungs and allowing them to expand. Then when you exhale, the opposite happens. The diaphragm relaxes, moves upward, creating less space in the chest cavity and pressing the air out of your lungs. You can think about the diaphragm during each breathing cycle as an umbrella, expanding as you inhale and then contracting as you exhale. With the diaphragmatic breathing technique, we get correct deep core activation, which is key for Diastasis Recti recovery. That's why we will be using diaphragmatic breathing a lot in the Diastasis Recti recovery program. So our goal is to master the breathing technique throughout this course. You can do the diaphragmatic breathing in almost any position. You can be standing, sitting, on your hands and knees, or lying down on your back with your knees bent. You can place your hands on your belly, on your abdomen, to help you feel the movements better. So, start by taking a deep breath in, relaxing all muscles in your core, and feel how your belly expands. Then as you exhale, think about it like you're pressing the air out of your lungs with your whole core. I'm going to try to explain this in a few different ways. So, what I mean by your whole core is that we're going to engage the core muscles beginning at the bottom and working our way up. You can think about the core muscles as a box. The pelvic floor is the bottom, the diaphragm is the top, the transverse abdominals are the sides, rectus abdominis is the front, and then your back is on the back. So we're beginning at the bottom, working our way up, scooping from the lower abdomen, tightening your core from downwards and up. I'll break it down. As you begin to exhale, engage your pelvic floor muscles. You feel it comes together and lifts up. And when we engage the pelvic floor, it's not about squeezing as hard as you can. It's a gentle engagement. You feel like a gentle lift, just kind of like you're trying to stop the flow of pee. So be careful here not to overdo it and squeeze too hard. As you continue to exhale, engage your abdominal muscles, both at the front and the transverse abdominals on the sides. Here. That's why it's good to keep your hands on your belly, on your abdomen, to feel these muscles contract. So you're kind of creating a wave of muscle contraction, starting in your pelvic floor, and then moving up as you exhale. Here. You can also think of it as a zipper, beginning at the bottom in the pelvic floor. Begin with the pelvic floor engagement and then zipping up. So, like this. You can also think of it like you're just using your core muscles to press the air out of your lungs. As you do this, a natural movement of the pelvis as you exhale is to tilt slightly backwards. Like this. If you're still not sure of what you're doing and you can't seem to get control of the core engagement, then try blowing into a balloon. When you do that, you automatically do all of these things that I've talked about. Try it out and be mindful about what's going on with your core muscles as you blow into the balloon. Now, as you inhale again, relax these muscles that you have now contracted, thereby expanding your ribs and belly, and focus on relaxing all muscle tension, including your pelvic floor. But don't just drop all the muscle engagement all at once. Make it smooth and controlled. How to use diaphragmatic breathing in exercises. So now that you know how to perform this breathing technique, you need to practice it and then implement it in exercises. So when you're finished exhaling, your core is fully engaged and you can keep this core engagement, you can maintain it and breathe almost normally like I'm doing now and perform whatever exercise you wish. This is how we use diaphragmatic breathing in many of our exercises. But sometimes we do one full breathing cycle for each repetition of the exercise we're performing, so re-engaging the core for each repetition. And sometimes we do diaphragmatic breathing only at the beginning of the set and maintain the core engagement throughout the whole set.